I urge you to pay close attention if you're a man over 60 and you've come to terms with the fact that getting up 2, 3, or even 4 times a night to go to the bathroom is just a natural part of growing older. Your fate is not that. The majority of guys completely misinterpret this warning signal from their bodies. This nighttime disturbance is not innocuous. It robs you of restful sleep, saps your vitality, and subtly feeds a vicious cycle of inflammation in your prostate that exacerbates the situation. A birthday card number isn't the only person responsible for this. Millions of guys engage in this one habit without giving it any thought. This particular activity directly causes quiet inflammation, which promotes the growth of your prostate and results in annoying symptoms, including urgency, weak stream, and disturbed sleep. Dr. Catherine Rocker is my name. The health and vigor of men in their 60s, 70s, and beyond has been the focus of my practice for more than 20 years as a geriatrician and men's health physician. Without hastily turning to drugs or surgery, I have assisted thousands of men in resolving prostate problems, getting their sleep back, and regaining their confidence. Age has very little to do with the same scenario I witness every day. I'll tell you exactly what this top-ranked bad habit is in a few minutes. I'll go into detail on why it's so bad for your prostate health, and most importantly, I'll give you a simple, all-natural way to stop it right now. Make sure to hit the bell notification and subscribe to this channel if you're serious about taking charge of your health and finding a permanent solution. We specifically created this content for astute men like you who are seeking genuine solutions. Please let me know in the comments below whether this message is landing so I can better comprehend it. Type number 1 if you're ready for a solution and are sick of your sleep being interrupted. In case you haven't encountered this yet, enter 0. Let's get started now. Let's talk about a behavior that may seem harmless, but it can actually do a lot of harm to your bladder and prostate. Eating a large, filling meal shortly before bed. I'll be the first to acknowledge that a big supper has a profoundly fulfilling quality. After a long day, it can feel like a pleasure to unwind and savor delicious meals. However, this everyday practice might exacerbate the annoying symptoms of urgency, dribbling, and frequent midnight bathroom visits for men with prostate issues. The substantial physiological chain response is the problem, not just the food itself. It starts at the exact moment your body needs to relax. This is what occurs. Your digestive system must work overtime to process a large, heavy meal, particularly one that is strong in protein, fat, and salt. A significant increase in blood flow to your stomach and intestines is necessary for this. Your body temporarily diverts blood from other areas, including your pelvis, to meet this requirement. Given that blood supply to the prostate and bladder is already naturally diminished in older adults, this is a serious issue. This produces a low oxygen atmosphere that irritates the lining of your bladder and prostate and encourages silent, local inflammation. Even worse, eating late inhibits the body's normal production of an important hormone called ADH. With less ADH, this hormone instructs your kidneys to generate less pee at night. When you try to sleep, your kidneys continue to produce urine at the same rate as during the day, which causes your bladder to fill up far more quickly. Your sleep pattern may be drastically disrupted if you go to bed feeling good, only to be startled awake a few hours later by an unavoidable, urgent need to go, and then again a few hours later. What does this actually look like in day-to-day life? You go to bed at 10 after finishing a big dinner at 8. You're up by midnight, again at 2:30, and possibly again before your alarm clock goes off. You wake up feeling worn out and unrested, and this ongoing weariness can make all other health issues seem more challenging. Here's my simple recommendation. Establishing a clear buffer zone between your final meal and nighttime is the most beneficial adjustment you can make. Try to get at least 3 or 4 hours. This allows your body enough time to finish most of the digestive process before you fall asleep. Reduce the amount of heavy red meats, fried meals, and extremely salty dishes in your evening meal, and instead emphasize vegetables, nutritious grains like quinoa or brown rice, and lean proteins like chicken or fish. If prostate symptoms are an issue, I also advise my patients to limit their intake of alcohol and caffeine to the afternoon, and to move most of their daily fluid intake to the morning and early afternoon. Try raising your feet for 30 to 60 minutes in the late afternoon if your ankles are swollen. This aids in your body's digestion of the excess fluid long before you go to bed. I understand that this may seem like a sacrifice, and it can be difficult to break a lifelong eating habit. You don't need to be flawless, which is wonderful news. Consider it as rearranging your evening meal a little earlier and making it a little lighter, rather than giving it all together. The reward is enormous. After making this change, a lot of my patients say they see a change within 10 days. They wake up feeling truly rejuvenated, have a stronger pee stream, and have fewer overnight urination. That is a worthwhile trade-off. Just make a note of how you slept and what time you finish eating tonight. For a few days, try increasing your dinner time by only 30 minutes and observe whether anything changes. Record your nocturnal bathroom visits in a straightforward log. It is a strong motivator to watch that number decline. Even though this practice is a big trigger, there is another extremely typical daily behavior that more directly upsets your hormone balance, and you're probably doing it without even realizing it. A statement made with pride is one of the most common things I hear from my male patients. "Doctor, I've really reduced my fluid intake, especially in the evening," a man in his 70s will say as he sits in my office. "I don't have to get up at night because I don't drink much." This seems like such a simple, sensible answer, and I always respect the astute intent that went into it. It makes perfect sense that you are attempting to fix the situation. However, I must politely inform you that this well-intentioned tactic is actually having the opposite effect and exacerbating your symptoms. You end up feeling the want to urinate much more even while you are drinking less to do so, creating a frustrating paradox. The reasoning is straightforward and intuitive. Urine should be reduced when less fluid is consumed. However, the physiology of your body functions in a more intricate manner. Your pee gets extremely concentrated when you restrict your fluid intake. Imagine it as a potent chemical solution. It is more acidic, darker, and much more irritating to your bladder's delicate lining. This irritated bladder then becomes hypersensitive and inflamed. Even when it's barely half filled, it begins to send your brain urgent, empty now impulses. This is a double wham for a man who already has an enlarged or sensitive prostate. The urge to go right away, the dribbling, and yes, the overnight visits are all significantly worsened by the increased pressure and urgency that the hyperactive, inflamed bladder is now exerting against the prostate. Your bladder may eventually become hyperactive as a result of this ongoing irritation, creating a recurring cycle. This pattern may be familiar to you. Throughout the afternoon and nighttime, you purposefully drink relatively little. You feel like you've accomplished something when you go to bed, yet a few hours later, you wake up with an unexpectedly intense and pressing urge to urinate. The temptation is overwhelming, even though the volume isn't too loud. Chronic low-level dehydration hinders your body's ability to properly eliminate waste products and metabolic poisons. This makes it possible for them to concentrate in your tissues, causing swelling and systemic inflammation. This can exacerbate prostate inflammation and impede the body's natural healing mechanisms. Urine production is only one aspect of proper hydration. It's a key component in lowering inflammation in every part of your body. Consistent, continuous hydration throughout the day, rather than restriction, should be your aim. During breakfast and the middle of the afternoon, you should concentrate on consuming the majority of your fluids. Your urine's color is a very useful indicator. A faint, pale straw tint is what you want. Your urine is overly concentrated if it is dark yellow in color. You should never completely stop drinking water, but you can start tapering off your fluid intake around 90 minutes before bed if you're worried about overnight trips. It's okay to take a tiny sip to relieve thirst. We must change the way we think about water. Your troubles aren't being caused by the enemy. In fact, It's your greatest buddy when it comes to soothing irritated bladders and lowering general inflammation. Therefore, if conserving water is obviously the wrong course of action, it begs the question of what other well-meaning behaviors might be contributing to the problem. Is it possible that the foods and beverages you regularly consume to maintain your health are really increasing the acidity and inflammation of your prostate? One patient I recall was Mr. Daniels, a lively 68-year-old who enjoyed being active. His frequent painful midnight toilet excursions and abrupt increase in urgency were the reasons he came to me. He recalled having a huge glass of fresh orange juice every day and having a large salad with tomatoes for lunch when we went over his diet. He also enjoyed incorporating spicy sauce into his evening dinners. All of these decisions seemed good on the surface, yet they were escalating the situation for his delicate system. This emphasizes a fundamental idea that I convey to my patients. Consider food as information rather than just calories. Every bite gives your body biochemical cues to either reduce inflammation or, in certain situations, increase it. For men who are concerned about their prostate, meals that are extremely acidic can give the wrong message. Your body absorbs the acidic components in foods like oranges, grapefruit, tomato sauce, salsa, and spicy peppers. These acids are finally removed by your kidneys and expelled into your urine. Your urine becomes more acidic as a result of this process. This isn't a problem for most individuals, but if you have an enlarged or sensitive prostate, the acidic pee can be a continual irritation. The already fragile lining of your bladder and urethra is treated like a weak acid every time you urinate. A local inflammatory response is brought on by this irritation. To address the apparent harm, your body sends immune cells, which then produce chemicals that make the little area of your pelvis enlarge and feel tender. The prostate is immediately aggravated by this inflammation, which tightens the urethra and exacerbates all symptoms, including urgency, a weak stream, dribbling, and those tiresome overnight excursions. The damage is gradual and subtle. The issue isn't with just one glass of juice. It's the regular routine that progressively intensifies pain and inflammation. The good news is that you can feel a great deal of relief by making a few simple changes. Simply increase your awareness of certain foods. You don't have to completely cut them out. I suggested that Mr. Daniels begin by recording his symptoms and eating habits for a week. He recognized the connection immediately. He started by replacing his morning orange juice with a banana, blueberry, and almond milk smoothie. Instead of a snack with tomato salsa, he opted for an apple with peanut butter. Instead of using hot sauce for taste at supper, he utilized fresh herbs like oregano and basil. Additionally, he made it a point to eat any meals that had tomatoes earlier in the day, rather than directly before bed. Mr. Daniels noted a discernible change in roughly 2 weeks. His nightly excursions were halved, and the incessant sense of urgency had subsided. He felt in control again and was sleeping through the night. Here, progress, not perfection, is the aim. Keep in mind that eating habitually differs from making deliberate decisions. After specific meals, observe how your body feels, even if your diet is flawless. This method focuses on figuring out what foods make you feel your best, but most men totally overlook another extremely frequent daily habit that progressively upsets the delicate balance of prostate health, acting like a slow-motion earthquake. I am fully aware of the various causes of this. Energy levels fluctuate, life becomes hectic, or you may just feel that it is no longer a priority. Maybe you think it doesn't really matter for your health, or that it's an indication of conserving your vitality. I frequently hear similar justifications, and I approach this subject with no bias other than the desire to impart crucial physiological knowledge. Many men are unaware that persistently disregarding the body's natural desire for release can turn from being a personal preference into a factor that actively fuels inflammation and congestion of the prostate. Regular ejaculation aids in the removal of seminal fluid, which is produced in large quantities by the prostate gland, as well as any substances that have collected in the ducts. The gland and its supporting components may enlarge and stretch over their typical comfortable limit when release occurs seldom. Imagine it as a little, fragile sponge that is frequently filled but infrequently squeezed out. The pelvic area experiences low-grade pressure and weight as a result of this persistent fullness. This continuous pressure directly irritates the sensitive tissues of a prostate that may already be less resilient. Urinary urgency, a weaker stream, and a sense of incomplete emptying are all common signs of congestion, which can also aggravate inflammation and cause a heaviness or pain. A secondary risk is also created by this circumstance. The discomfort itself may deter people from wanting to ejaculate, which can unintentionally lead to a vicious cycle in which less activity causes congestion, which in turn causes even less activity. I remember Walter, a patient who was in his early 70s and incredibly sweet. He loved gardening, but he came to me feeling dejected since his favorite time in his garden was being interrupted by frequent urination and a persistent, bothersome feeling of pelvic pressure. He was reluctant to mention it, but it had been months when we politely brought up the subject of how frequently he had sex with his partner. He had dismissed it as just another aspect of life that he had to come to terms with. I gave him an explanation of this mechanism of congestion and emphasized that this was a medical advice for prostate drainage. If partnered sex was not a possibility, I advised him to try for a more regular rhythm, even through masturbation. Despite his obvious skepticism, he decided to give it a shot. Weeks later, he was a completely different person at his follow-up appointment. The steady pressure had subsided considerably. He declared with pride that he was once again able to spend entire days in his garden without being constantly interrupted by potty breaks. The relief was emotional as much as physical. He believed that his sense of control and normalcy had returned. Here, the obvious recommendation is to pay attention to your body's cues and strive for a consistent release rhythm. Aim for the equivalent of 2 to 3 times per week for prostate health. However, there is no one-size-fits-all amount. This is more about upkeep than performance, like stretching or drinking enough water. This is a basic physical maintenance practice that helps relieve psychological stress. In the long run, maintaining this routine can encourage improved urine flow, lessen congestion, and preserve healthier prostate function. Although this habit is important, the following one we need to talk about may be even more harmful to your health, because it's something you probably do for hours on end every day, and it directly impacts inflammation and circulation in the most vulnerable place. One of my patients, Douglas, was a bright 72-year-old retired engineer who enjoyed reading in the mornings and working on complex model ships at his desk in the afternoons. His increasing urine urgency and a persistent, dull pelvic soreness that was most obvious when he attempted to stand up after a prolonged period of sitting were the reasons he came to me, not his hobbies. Though it was subtly working against him, he believed that his cozy recliner was his haven. This is a widely held belief. We view sitting as a healthy, well-earned respite. However, sitting for extended periods of time without interruption puts constant low-level pressure on your entire pelvic area, which can lead to a host of issues for prostate health. Your body weight puts pressure on your bladder and prostate when you sit for long periods of time. Healthy blood supply to these essential tissues is greatly diminished by this ongoing pressure. Imagine treading lightly on a lawn hose. The water turns into a trickle. The prostate receives less oxygen and nutrients due to decreased blood flow, and waste products from metabolism begin to accumulate. The main cause of tissue swelling and local inflammation is this stagnant environment. This extra inflammation tightens the urethra in a prostate that may already be enlarged, which immediately causes a weaker stream, increased urgency, and the sensation of heaviness or discomfort Douglas mentioned in his description of the pelvis. Because it occurs gradually, the harm is subtle. The gradual onset of symptoms is sometimes attributed to aging alone because you don't feel your circulation decreasing down minute by minute. Movement is a necessary medication for prostate health, but it is not the same as exercise. Circulation is movement. Every 20 to 30 minutes, set a timer. Just get up when it goes off. That's all. Jumping jacks are not required of you. Simply stand for 30 seconds, move your weight slightly, stroll to a window, or take a few steps to the kitchen. Because they immediately lower pelvic pressure, these micro breaks are effective at flushing out inflammatory waste products and bringing in fresh, oxygen-rich blood. This was a revelation to Douglas. He began to use his stove's timer. He noted that his pelvic pain had drastically decreased after just a few weeks of regular micro breaks. During his extended periods at the workbench, he felt more at ease and his sense of urgency diminished. Consistent circulation is essential for the health of your prostate, and the easiest method to keep it going is to alternate extended periods of sitting with short bursts of standing. This one adjustment can help soothe those annoying urine symptoms by lowering pelvic pressure and inflammation. The first habit is one that I see heartbreakingly frequently in my clinic, and it frequently surprises the guys who regularly take sedative-type drugs. During a checkup, one of my patients, a charming 75-year-old man called Arthur, who had been taking a prescription sleep aid for more than 10 years, mentioned that his prostate symptoms, particularly the frequent overnight excursions, were becoming considerably worse. "But doctor, I take my pill to sleep through the night," he added, giving me a sincere look of bewilderment. Why I'm up so much is beyond me. He was unaware of the fact that the drug he used to sleep was a major cause of his issue. Certain sleep aids, anxiety-reducing drugs, and even some over-the-counter cold or allergy medicines are examples of typical sedatives that do more than merely soothe your brain. Your entire neural system, including the autonomic processes that control blood flow, can be depressed by them. Accordingly, these drugs may unintentionally decrease blood flow to peripheral organs, such as the prostate gland. A prostate that already has reduced blood flow gets even less oxygen and other nutrients, which makes it more susceptible to inflammation and less able to heal itself on a daily basis. Additionally, even while these drugs may aid in falling asleep, they frequently seriously alter the structure of sleep. They have the ability to inhibit the deep, healing phases of sleep, which are essential for immune system modulation and tissue regeneration. Thus, the prostate is left in a constantly weakened, inflammatory state, since it is both deprived of sufficient blood supply and the ideal conditions for healing, night after night. Because their prostate tissue is inherently more vulnerable to stress, and their bodies digest drugs differently. Elderly men are particularly vulnerable. The most crucial thing you can do is talk openly with your doctor about the medications you are taking. Examine all of the over-the-counter and prescription medications you frequently use. You must never stop taking these drugs suddenly, because this can cause serious withdrawal symptoms. Your doctor must oversee and manage a cautious tapering procedure for any changes. Investigate non-pharmacological methods as your main tools at the same time. Compared to medicine, cognitive behavioral therapy for insomnia, or CBTI, is significantly safer and more successful in the long run. Therapy and mindfulness exercises can provide long-lasting relief from anxiety. Second-generation antihistamines are frequently a better option for allergies. This marked a turning moment for Arthur. Despite his reluctance, he consented to start CBTI techniques and work on a very slow, tapering timetable. After cutting back on his dosage, he observed a discernible improvement in a few of weeks. He felt his sleep was really more refreshing, and the number of nighttime journeys he made dropped from 4 to 2. His body was at last able to cycle through the appropriate stages of sleep, and he was waking up feeling more rested. It's challenging to cut back on or stop taking these drugs. I won't lie, but it's probably one of the best things you can do for your heart, prostate, and general well-being. The benefits to your quality of life are enormous, but it takes time and medical care. What does all of this leave us with then? We must be clear. I need you to comprehend something basic if you've been having trouble with your prostate health, feeling irritated by disturbed sleep and a lack of control. You're not damaged. You've just been ignorant. Before we begin working together, every single male in my clinic experiences that irritation, that fear, and even that embarrassment. However, your strength lies in your knowledge. Being aware of these routine behaviors empowers you to take action and regain control of your health and nights. You don't have to completely change your life. Small, deliberate, and regular actions will result in long-lasting improvements to your prostate health. Awareness is the first step. It develops when you pay attention to your body and give yourself the prompt attention and care you need. Avoid attempting to change all 6 habits at once. Overwhelm results from that. After reading that list, I want you to pick just one habit that you are sure you can begin changing now. Perhaps it involves rescheduling your dinner for an hour earlier. Maybe it's setting a timer to wake up every half hour. Or perhaps it's making a commitment to have a glass of water with every meal. Pay attention to that one thing. We all grow when we share. So please share what you learned today and what change you're ready to make in the comments box below. Let's support each other. If you found this movie useful or if it even slightly opened your eyes, please click the like button. To be sure you don't miss any information that could change your health, click subscribe. Before you go, ring the bell. If this video was helpful, please enter 1. If not, enter 0. You might not be aware of the significance of your comment. Appreciate that advancement. Keep in mind that this is not a sprint, but a marathon. It's never too late to make a change that improves your health because your prostate responds to treatment at any point. Please do me a tremendous favor and click the like button if this video was helpful. It indicates to the YouTube algorithm that this is content that males over 60 should find. Additionally, share this video with any friends, brothers, or loved ones you know who are dealing with these same problems in silence. Together, we can create a community of knowledgeable and capable guys. Lastly, please comment below. Which of these 6 behaviors most appeals to you? Let me know. Which will you start with? You care about taking action, which is why you've come this far. Together, let's proceed. Better prostate health, sound sleep, and a return to your former self are all very much within your grasp with this information and a few simple actions.